How does patient autonomy shape medical veracity? Imagine being in a doctor's office, trying to understand your health. You want clear, honest answers so you can make the best choices for yourself. That's where patient autonomy and medical veracity come together. Patient autonomy is the right of individuals to make their own healthcare decisions. It means patients should get truthful, complete information about their health. Healthcare providers have an ethical duty to tell the truth because honest communication helps patients make informed choices. Without accurate information, patients cannot truly exercise their autonomy. Providing truthful information is not just about facts. It involves understanding what the patient wants to know and how much detail they can handle. Some patients prefer to know everything, while others may want only the basics. Respecting these preferences is part of honoring their autonomy. So, veracity means being truthful but also sensitive to what each patient needs and wants to hear. Trust is a big part of this relationship. When patients believe their healthcare provider is honest, they are more likely to follow treatment plans and stay engaged in their care. If a provider withholds information or is dishonest, trust can break down. This can lead to patients feeling unsure or even avoiding care altogether. Shared decision-making is another way patient autonomy influences veracity. Instead of just giving facts, doctors and patients work together. The doctor supports the patient's understanding and helps them weigh options. This approach makes sure the patient's values and preferences are part of the decision process. To practice this well, clinicians should ask patients how much they want to know and what kind of information they prefer. They should give clear, truthful explanations about diagnoses, treatment options, and possible risks. It's also important to avoid overwhelming patients with too much information or truth dumping. Sometimes, patients may choose not to know certain details, and respecting that choice is part of honoring their autonomy. In cases where withholding information could cause harm, honesty becomes even more important. The goal is to balance truthfulness with compassion and respect for the patient's wishes. This way, veracity supports autonomy by giving patients the knowledge they need, and autonomy guides how truth is shared. In the end, patient autonomy and medical veracity are like two sides of the same coin. They work together to create healthcare that is honest, respectful, and centered on the individual. When doctors communicate truthfully and listen to what patients want, it builds trust and helps patients feel empowered in their own care.